Good afternoon. It's midweek. You done know. Today, I want to talk about worldviews and how worldviews coincide with mental health, especially mental health within the Black community. So, first of all, let me just say what worldviews are. A worldview is a collection of attitudes, values, stories, and expectations about the world around us, which inform our every thought and action. Worldview is expressed in ethics, religion, philosophy, scientific beliefs, and so on. So today I'm going to tell you about how worldviews are expressed from an ethnic group point of view. So the worldview is beliefs, values, attitudes that are shared within each individual ethnic group. So I kind of did a research. So this is not coming from a personal opinion, but a proven facts and statistics shared, which you could research online. So in the Southern Asian community, that would mean like Punjabi and what have you. They are Southern Asians. Their worldviews towards mental health is that there's a lot of stigma. So it remains a stigmatized issue in many South Asian families where cultural expectations and generational beliefs discourage conversations about psychological well being. So, it's a subject that they don't talk about, it's discouraged. Um, and there's also a lot of stigma applied to within the Southern Asian ethnic group towards mental illness. So they're encouraged to suppress their struggles rather than go out and seek help, like from resources such as CAM age, counseling, and what have you, to treat mental illness rather than ignore it or suppress it. The Filipinos' worldview on mental health is a complex mix of traditional beliefs, cultural values, modern influences that often lead to a unique approach to mental health challenges. So, a detailed look is that mental illness can be perceived as a family issue that leads to shame and reluctance to seek any help outside the family circle. So they in within the Filipinos' worldviews towards mental illness is that they encourage individuals to cope with psychosis, schizophrenia, depression, and anxieties, which all fall under the umbrella of mental illness, and also ignoring mental health problems. So, the question that we have to ask ourselves, the majority of staff and nurses and what have you that work at CAMH, Michael Garin, and other Canadian institutions, because of the what I've shared with you previously, that the Employment Equity Act mandates employers and entities to hire a certain amount of individuals who belong to the visible minority groups. So in these hospitals and institutions, they meet and even exceed their quota of how many visible minorities that they hire. And this is why we see when we walk into a hospital, the majority of nurses and practitioners, even in mental health wards, are Filipinos, and Southern Asians. So, this is why a lot of people are walking around the city of Toronto with mental illness because the worldviews of the workers at CAMH and Michael Garron and other institutions that have psychiatric units in their hospitals, because the people that are now working within these sectors that have to do with the treatment of mental illness, the Filipinos believe in ignoring it, that it's a shame on the family if they have a family member who is living with mental illness. And Southern Asians, they ignore it, and they also see it as a shame to the family. So, what kind of care do you think that these people give to people that walk through a hospital doors seeking help, or families that bring their loved ones to get help to treat mental illness? If the people that are working there who grew up and belong to an ethnic group that ignores mental illness, doesn't want to hear it, has so many stigma applied to mental illness, what does that tell you? That now in Canada, that your family member or even you yourself, when you walk through a mental institution, mental health care institution, the majority of the people working there, their core belief towards mental illness is to ignore it. They apply stigma and discourage even talking about mental illness and mental health and what have you. And it's really sad to know that just to perpetuate the marginalization of Black people in this country, that they fill their Employment Equity Act quota and hire visible minority that are non-Black, who do not share these values and beliefs and worldviews when it comes on to mental illness. So when you ask yourself, how come there's so many people lately walking around Toronto who are clearly living with mental illness, being ignored and cast aside? It's because now the institutions that are paid to treat and help people with living with mental illness, their core values and beliefs, worldviews, are to ignore mental illness or apply shame to family who has loved ones that are living with mental illness, and to discourage even talking about it. So, do you see why mental illness is an ongoing and a growing crisis in Canada? It all leads down to racism, because many employers in Canada would rather fill their quota of visible employees who are a visible minority with any other visible minority group than Black people. So do you see how racism and the perpetuation of racism in Canada is like a domino effect? You don't know. So when I say it's a crying shame that only 382 Canadians support a national petition to hold the government accountable and to demand that legislation be made to combat anti-Black racism in Canada, these are some of the reasons why. You don't know. You could find that petition at www.blackpeopleunitedforchange.ca. Not only are we as Black Canadians affected, but because of the dark and hidden reasons behind certain policies and things that are in place, we have people walking the streets of Toronto, and their cries for help are ignored, or their family is seen as a shame and a disgrace instead of giving them the help that they need. Canada, oh Canada.